One of the biggest impacts of the global COVID 19 situation has been the effects on our collective mental health. Studies on the global burden of disease were already showing that mental disorders make up 5 out of 10 leading causes of disability in the world, and this was before the pandemic started. The stress, anxiety, and depression stemming from fear, isolation, and stigma around COVID 19 have affected all of us in one way or another. Kids can't go to school, or at least in some places, and normally see their friends. Many people are losing their jobs, and the elderly are isolated from their usual support network. Of course, the past year has been hard on healthcare workers, having to work long hours, personal risk of exposure to the virus, and witnessing firsthand the loss of people's colleagues and loved ones. Here in the United States, mental health conditions are affecting as many as 1 in 5 people, around 47 million. As devastating as COVID 19 has been, current case numbers are sitting at half that amount. The issue is that the effects of the pandemic on our mental health may be far longer lasting than the disease itself. COVID has also caused disruptions to our mental health in an indirect manner. The measures taken to slow the spread of the virus have affected our physical activity levels, our eating behaviors, our sleep patterns, and our relationship with addictive substances, including social media. And to this last point, both our increased use of social media while stuck at home, as well as the increased exposure to disaster news over the past year, have amplified the negative effects of social media on our mental health. Thankfully, the news is not all bad, especially with new plans for rolling out of the vaccines. So in this video, I want to give some recommendations for boosting your mental health as we get through this pandemic together. Now, the first thing is, of course, exercise. There's new, even stronger evidence for the positive benefits of exercise on mental health. All of the most common forms of aerobic exercise, like walking, running, or stationary cycling, have displayed these improvements. Encouragingly, these benefits have still been present at follow-ups up to 12 months after the interventions have ended. Now, what about resistance training? This too has provided similar reductions in depressive symptoms over an 8-week period compared to cardio. Now, you don't have to exhaust yourself, so either low to moderate intensity exercise improves mood and vigor, while high intensity training, if overdone, has more potential to increase tension and fatigue. The American College of Sports Medicine recommends at least 2 to 3 20 to 30 minute exercise sessions per week. During isolation, we can enjoy the saved transit time and decreased cost of working out at home. Of course, nutrition plays a role as well, so epidemiological studies investigating the relationship between diet and mental health have steadily increased over the last decade. Research is showing the increased risk of developing depression and anxiety when consuming a highly processed Western diet. Now, on the flip side, studies have also emerged showing the link between a diet rich in fruits and vegetables, healthy fats, nuts, fish, and low in processed foods, and the protection from developing common mental disorders. The Mediterranean diet has been ranked the healthiest way of eating by dietitians and doctors for the 4th year in a row. It's a non-restrictive, mostly plant-based eating style, which has been extensively researched with study after study showing benefits for weight loss, lower risk of diseases like diabetes and high blood pressure, better digestion, and even healthier aging. The diet is based on eating habits in regions like Greece and southern Italy, the so-called blue zones, which are regions of the world where people tend to live the longest, healthiest lives. More than a third of adults experience sleep difficulties. In the first half of 2020 alone, US Google searches for insomnia increased by 58%. More often than not, these problems occur in conjunction with physical and mental health burdens. Since COVID-19 has disrupted our daily routines, our sleep hygiene, as it's known, is suffering as a result. Some things you can try to improve your sleep quality include eliminating screens at least an hour before bedtime, incorporating some form of mindfulness or relaxation into your routine, whether that be yoga or breathing exercises or guided meditation, mindfulness, and also optimizing your sleep space. This includes making sure the room temperature, light exposure, and noise levels are all conducive to getting a restful sleep. And if you have dry air in the home, maybe a humidifier will help with your sleep as well. And one more point I want to make is that a lot of people have undiagnosed allergic rhinitis, whether that be perennial allergic rhinitis or seasonal allergic rhinitis. And what happens is their nose becomes very stuffy and their mouth breathers at night. And so they have a harder time getting a good night's rest and they don't even recognize this problem. And so this is me, actually. So it's not only me, it's a lot of my patients and a lot of people in the population don't even realize this. So this is something that you should be aware of, and maybe it doesn't apply to you, but a lot of people do have this condition, so it could be something for you to think about. Depending on the weather and restrictions in your area, you may be able to get outside for a certain amount of time each day. I suggest you take this opportunity whenever possible. The restorative properties of interacting with nature include lower levels of stress and reduced symptoms of anxiety and depression. Getting outside also means you're spending less time on social media and away from your phone, and the importance of this can't be underestimated. You'll also get the benefits of healthy sunlight exposure, weather permitting. This plays a vital role in mental well-being by regulating our energy levels, and it also is a source, or at least partly a source, of our vitamin D supply. Since the pandemic has started, I started running outside again, and it feels amazing. One of the major causes of the COVID mental health burden is our isolation from others. It's critical to reach out in meaningful ways to friends, family, and colleagues for their sake as much as your own. I would advise, wherever possible, to use a visual means of communicating with your circle, whether that be through Zoom or FaceTime or Skype or whatever. At the very least, try to have a voice call. As useful as texts are, well, they lack the expressiveness and body language and tonality that make up the bulk of how we connect with one another on a meaningful level. Now, during Christmas, I was able to FaceTime with my family. About 8 different phones were involved, where we're all connected at once. And my brother told me you can actually have up to 30 people or so connected on FaceTime, so that was pretty cool. And for those dealing with more serious mental health challenges, there are services out there to provide help. The pandemic has allowed for vast improvements in access to and delivery of online support services. And the final tip I have for mental health is to stay positive. So having a positive mindset is easier said than done, but it does help with improving your mental well-being. And even though we are undergoing difficult times, with the worst of the worst being January 2021, there is light at the end of this tunnel. Not only do we have the new rollout for the Pfizer and Moderna vaccines in the works, but there's also the Johnson & Johnson and the AstraZeneca vaccines that are on the horizon. Also, the number of people who've been reported to have been infected with coronavirus is at least 23 million, but this isn't really accounting for all the people who've had asymptomatic disease or mild disease who actually haven't been diagnosed with COVID. So most experts are estimating that the true number of coronavirus cases in the United States is around 70 million. That means that about 20% of the population will be immune to the virus as a result of their previous infection. Then when you throw in the warmer, more humid air going into the spring and summer, in combination with the new Biden administration and some of these newer medications that are helping to mitigate severe COVID disease, there's definitely light at the end of this tunnel. And I expect that by June, July, then this pandemic is going to get much, much better and hopefully over with by the fall. Hopefully, these tips have helped give you some inspiration as we get through this home stretch of the pandemic together. So thanks for watching, and I'll see you in the next one.